Was there a specific moment that compelled you to get into scoliosis?
No, there wasn't. I was thinking about surgeries. I was really drawn to orthopedics for a lot of reasons, pediatric orthopedics in particular. It's the same thing in fellowship. I was like, well, but I'm going to do something private practice where I do some the pediatric orthopedics in adult. And then about a month into my chief year, after I'd already accepted a fellowship but hadn't started my fellowship yet, I was like, oh, I'm kidding. I really liked spine deformity, and I particularly liked early onset, which is sort of, I kept deviating to the problems that were least solved, I think. So early onset scoliosis is one of the problems of pediatric orthopedics that's not very well solved, as you know, because we're contending with this ongoing growth in the face of a big deformity. So that kind of became my particular area of interest by the time I started my fellowship. I actually started in Ireland, ended up getting my degree from Alabama because my parents had moved down there. And they did my fellowship at Case Western Rainbow Babies and Children, which is a fabulous program. And then went back to University of Michigan, which was where I'd done my residency. Was on faculty there. Came to Children's National Medical Center, I think in 2004. I was chief there for 10 years. And then most recently was at the University of Florida. Really got the spine program going there. And then got some support from the Shriners, which was just an immense help to building that program. So it's going to really make a huge difference for the kids in that community. During that time, I've been involved in Scoliosis Research Society. I was the first woman elected as an officer at SRS, which was also a big honor. And that's probably been the society that's been the biggest part of my career in terms of what I've gotten out of it and what I've given to them in terms of involvement. It's been really great to continue to understand what our challenges are. Also the Pediatric Orthopedic Society in North America, which is another really wonderful volunteer organization for pediatric orthopedic surgeons, mostly in North America, but also internationally. And then finally, there's the International Congress of Early Onset Scoliosis, which is people that specialize just in scoliosis, just in kids under 10. And that's been also really important. We have a study group that is involved with that meeting, who supported that meeting called the Pediatric Spine Study Group, which takes care of young children with spinal deformities and tries to solve those problems because we can pool the results from a bunch of really great surgeons internationally. So I might have 5 children with a certain rare condition or syndrome, but internationally in that study group, we can pool our data from maybe 70 children and really start to get some better answers for the best way to treat some of these problems.